Discover the power of breast imaging in the fight against breast cancer as we delve into an exclusive interview with one of our experienced mammographers, unveiling the key differences between breast screening and diagnostic mammography. Before we do, make sure you subscribe to the I-MED Radiology YouTube channel for more content. Let's dive in.
So screening mammography in Australia is done through BreastScreen. This is a free national screening program with the aim of reducing the burden of breast cancer on the community. This program targets the assumably healthy population, or basically people without any active breast-related symptoms. Women from 40 onwards can get a free mammogram every 2 years. However, the ideal target population are women between 50 and 74. Because it is a screening program on asymptomatic patients, they are limited in the amount of images or projections taken, as there needs to be a greater benefit than harm, which in this case is radiation, for the patient for it to be justifiable. So diagnostic mammograms do differ in a few aspects to screening mammography. The main one is that a patient will have symptoms. So for example, a breast lump, they would seek out a diagnostic pathway via getting a referral from their GP. Because we are a diagnostic practice and are investigating active symptoms, we are justified in taking more images for a more thorough investigation. Most commonly, we would use tomosynthesis mammography as opposed to BreastScreen using conventional mammography at their initial appointments. And also diagnostic mammograms are also taken in conjunction with ultrasound, and sometimes we may even progress to a same-day biopsy if the results are concerning. So first and foremost, patients should expect to be made to feel as comfortable as possible. A lot of time, first-time patients come in with anxiety because they hear things from friends and family that they may not like, but it is definitely not as bad as people believe. As a mammographer, we have an ethical duty to our patients to ensure they are as comfortable as possible and not in any pain during the procedure. We will give our patients gowns before the mammogram, but however, patients should expect to be topless for the actual mammogram procedure. The machine is very sensitive to artifacts, and small things such as dust or hair can mimic pathology. The breast is then compressed between a paddle and a detector. The compression is uncomfortable, but it shouldn't be painful. The mammographer should always be checking in with the patient to make sure that they're tolerating the pressure given. The most important thing for the procedure is for the mammographer and the patient to both have open, flowing communication. That's probably the biggest key factor in a successful mammogram procedure for both patient comfort and their resultant images. So mammography is a very user-dependent modality. BreastScreen have developed a very strict grading system to determine whether an image taken is acceptable or not. The quality assurance and the quality control required of a mammographer is quite high due to the importance of early detection. It's very important to get as much breast tissue as possible on all projections taken. Missing anatomy can lead to missing pathology, which is just detrimental to a patient prognosis. As a mammographer, there are many key factors involved in getting the best images possible. The first one is gaining a patient's trust. If the patient's comfortable with us, they're more likely to be relaxed and better talked through the procedure. A second thing is to realize that no two breasts are the same. So our knowledge of how to manipulate both the machinery and the patient, depending on their body habitus, is what's needed to achieve the best pictures possible. So a lot of breast cancers can be asymptomatic until they have progressed or metastasized. If a breast cancer is detected early, so small and localized, the 5-year survival rate can be as high as 98%. So diagnosing a breast cancer early results in more options being available to the patient and thus a better prognosis. So overall, the importance of detecting and excising the cancer before it advances can literally mean the difference between surviving or not.
We hope you've gained valuable insights into the incredible capabilities of diagnostic imaging at I-MED Radiology. Remember to always speak to your healthcare provider about any health concerns you have so that they can arrange the most appropriate test for you. And don't forget to subscribe to our YouTube channel for more informational content.